in how decriminalization of drugs is taking place around the world. What I think you'll take away from this session is a sophisticated understanding of what decriminalization of drugs means and why it makes sense. My colleagues will outline the relationship between public health and harm reduction and real-world accomplishments of drug decriminalization. They will discuss what police and health authorities are doing right now to reduce disease, fatalities, and violence. I will provide a short legal background. When and where did the term decriminalization come from? What is some of the history of decriminalization? What does decriminalization mean in Maryland? And why is decriminalization required by the moral authority of law? According to the Merriam-Webster dictionary, decriminalize entered our language in 1969, and it means to remove or reduce the criminal classification of status of something while keeping it under some form of regulation. The term entered wide use in March 1972 when the National Commission on Marijuana and Drug Abuse issued its first recommendation saying that simple possession of marijuana should be decriminalized. Possession should not be subject to incarceration, but should have a penalty of a fine. This commission was created in 1970 as part of the same law that created the Controlled Substances Act. Many of us have forgotten that there was a kind of decriminalization back in that original law for possession. It was one time only. A court was authorized in the case of a first offender for simple possession of any drugs after a finding of guilt or a guilty plea to defer entering a judgment of conviction and placing the person on probation for up to a year. For persons under 21, after completion of probation, the charges would be discharged, the public record would be expunged, and the person could deny under oath any acknowledgement of the arrest or the indictment in the case in response to any inquiry made of him for any purpose. That was repealed in 1984. However, after 1972, the idea of marijuana decriminalization grew quickly, aided by new legislators, the Drug Abuse Council, Consumers Union, the American Bar Association, conservative commentators, and the lobbying of NORML. Beginning with Oregon in 1973 through 75, 76, 77, 78, 12 states decriminalized simple possession in amounts ranging from an ounce to 100 grams and setting fines at a few $100s. Unfortunately, teenage marijuana use rose dramatically in the later 1970s. This led to the rise of a conservative parent movement that claimed that the teenage marijuana use was being fueled by decriminalization, and those claims stopped the movement for decriminalization and led to the rise of the Bush-Reagan era of the war on drugs. By the late 1980s, as the HIV and AIDS epidemics arose, particularly among persons who were injecting drugs, the harm reduction movement took root in the United States. In the spring of 1988, Baltimore Mayor Kurt Schmoke, in a featured address to the U.S. Conference of Mayors, called for the decriminalization of all drugs to stop the spread of HIV and AIDS. That speech, grounded in harm reduction, more than any other event, inaugurated the critique of the war on drugs that over the past 30 years has brought legal changes we're discussing today. Now, turning specifically to Maryland and marijuana, since 2014, marijuana has been decriminalized in Maryland for the possession of less than 10 grams. And you can see that the fines are $100 for a first offense. And even for any number of offenses, the maximum fine is still only $500. Minors can be directed to drug education and assessment and referred to treatment. More than 10 grams of simple possession, up to 6 months imprisonment. And of course, distribution is a felony. It carries a penalty of up to 5 years imprisonment in the state of Maryland, up to $15,000 fine. Alcohol, a very powerful drug, is legal for adults. It's decriminalized for minors. Underage possession is a civil offense. A minor between 18 and 21 may be ordered to pay a fine of up to $500. A minor under 18 can be referred to juvenile court and supervision. Parents can distribute alcohol to their minors in their own home. Children can consume it in their home. But even the illegal furnishing of alcohol to other minors has been decriminalized. It's now a civil offense carrying a maximum fine civilly of $2,500. Nicotine. There's no penalty for minors to possess tobacco. That penalty was repealed in 2019. Previously, a kid could go to juvenile court who possessed tobacco. It's a misdemeanor with no imprisonment to distribute tobacco to persons under age 21, unless the people are in the military. Caffeine, another powerful drug, legal for adults, legal for minors. 85% of the US population consumes it. It does not even need to be labeled or identified in food, beverages, or candy. So I've quickly covered decriminalization and its status in Maryland. Caffeine is a useful motif for transition to my thesis that all drug use should be decriminalized. Caffeine addiction let's see if I can, hold on a second. Caffeine addiction in Britain and the American colonies, administered by drinking tea, was noteworthy in the 18th century. Britain put a tax on it in 1767 on tea that was imported. There were anti-tax protests. Troops were sent. Conflicts escalated. By 1770, we had the Boston Massacre. And December 1773, the Sons of Liberty, who wanted less expensive tea, dumped a couple of shiploads in Boston Harbor, the Boston Tea Party. From this perspective, the demands of people with an addiction to a certain drug, that is the daily tea drinkers, were one of the sparks of the American Revolution, a revolution about life, liberty, and the pursuit of happiness. So liberty is the core posture of the American people. The Constitution was established to secure the blessings of liberty to ourselves and our posterity. Well, of course, ourselves then in 1790 were property white males, but now our posterity includes all of us. That's a good thing. Liberty, it's minted on all the coins. In our public schools every morning, many public events before we begin, we recite a Pledge of Allegiance concluding with one nation with liberty and justice for all. So liberty can be taken in two ways. It can be taken away entirely when you're imprisoned by the criminal justice system. And it can be taken away or restricted when the legislature enacts something that it tries to forbid us from doing. In the instance of locking us up, well, there, of course, there's a whole lot of protection in the justice system. Due process, all the rights that we're familiar with. There's a whole lot to protect us once the law is now in operation. But for the process leading up to that, for the writing the law, there's very little in the way of protection. There's no real standard. The legislature doesn't sort of say at the beginning of each session, here's the principle we're going to follow that limits us in sort of deciding what we can enact and what we can't. Thurgood Marshall famously used to tell his colleagues, the Constitution does not prohibit the legislature from enacting stupid laws. Well, let me go, here in Maryland, banks can't do business on Sunday. It's against the law. Well, what's the authority for that? I mean, it's clear it's about somebody's Sabbath. Is it your Sabbath? If you worship on Sunday, do you need banks to be closed to protect your worship on the Sabbath? What about people who don't worship on Sundays? What if your Sabbath's on Saturday? These are examples of prohibitions where the legislature really doesn't have the moral authority to sort of do what it's doing. Let's look at a much more important liberty, the liberty to engage with our loving and intimate partners and spouses. In Maryland, you can get up to 10 years in prison for engaging in fellatio or cunnilingus. Only as of last October did we have a prohibition on sodomy repealed in Maryland. Now, if these acts are done by force, of course, that's rape, and you can get up to 20 years imprisonment, and that's not what we're talking about here. So it's the key point then is that the legislature has limits on its moral authority. And when we think about decriminalizing drugs, we're thinking about brain chemistry. We're thinking about, let's see if I can change this. Okay, let's see. All right, that stopped. There we go. So things that we enjoy, things which are pleasurable, are all a result of brain chemistry. These are things that we have the liberty to engage in. But these are all things that produce risk. These things can be dangerous. And the key point here is that the risks and the benefits are tied together. We know that people are at risk when they use drugs, but people desire the benefits. Even the DEA talks about the general sense of well-being by reducing tension in the use of narcotics and opioids. Risk is intrinsic in our American system. If I invest in a particular risky way, I can make money and be wealthy, or I can lose everything and become homeless, and my children can starve. Risks are essential to the American way. And so decriminalizing drugs is morally necessary because the use of drugs with all their risks confers benefits of mental experiences, feelings, and emotions that are intrinsic to liberty. I encourage you now to listen carefully to the rest of the panel. We're going to argue from a very different perspective, from the perspective of public health, public safety, science, and epidemiology, that harm reduction is morally necessary, and that government must abandon prohibition policies which increase the risks of death and disease and produce no benefits for the people who use drugs. Thanks very much.
Thank you, Eric. That was an excellent presentation. Now we're going to move on to Giovanna. Giovanna Margot works with the Global Drug Policy Program at the Open Society Foundation on drug policy reform in the United States. Her background is in research and advocacy on the topic of gender, drug policy, and harm reduction. She is a co-editor and co-author of the book, The Impact of Global Drug Policy on Women, Shifting the Needle, and has previously worked with the civil society organizations in Central and Eastern Europe to advance the rights of people who use drugs in the region. Giovanna holds a master's degree in critical gender studies from Central European University, and I have been fortunate enough to get to know Giovanna. I think it's been a year. It's definitely been a year, and I've been honored to work with her over the past year. Thank you, Giovanna.
Yeah, thank you so much, Nancy, for that introduction, and thank you to everyone joining us today. It's really an honor to be part of this panel and to speak further about this important topic. So today I'm going to be speaking about international models of drug decriminalization, how they function, and the outcomes that we can observe thus far in their implementation. And I just want to start by emphasizing that drug decriminalization is not necessarily a new phenomenon, although we're really starting to explore it further in the United States. But there are roughly 30 countries with some sort of decriminalization model, depending on what definition you use. And in some cases, these are only around particular substances such as cannabis. There are also a number of other countries which are considering decriminalizing drugs, such as Norway, which is kind of in a more advanced discussion. And it'll be interesting to see the developments there. So I want to turn now to look at two different models of decriminalization, which we would really consider best practice models. And these are the models of Portugal and the Czech Republic. And for those of you who were able to join us earlier in the fall, you will know that I already spoke a bit about the Portuguese model, but I want to provide an overview again for those who might not be familiar, and also bring in the Czech model as well. So in both of these systems, they really moved drug use out of the criminal justice sphere and into the realm of health and social services. And as a result, got really positive outcomes in terms of public health, rates of drug use, and social outcomes. And this, in the Portuguese case, was really done in response to a national drug problem, as well as growing rates of drug-related deaths and HIV incidents. On the other hand, the Czech Republic made its decision to decriminalize based on a cost-benefit analysis that they did of all of their criminal laws. And in that case, the research found that the penalization of drug use did not affect the availability of illicit drugs. Drug use had actually increased in the country under criminalization, and the social costs of drug use had also increased. And so based on that research, they decided to pursue decriminalization. And I think both of these models are really interesting for us in the United States to really consider, because we do have a public health crisis. Overdose rates are continuing to increase and have really worsened under the simultaneous COVID-19 pandemic. I think estimates are now that there was a 13% increase in overdose deaths last year. And I think we also need to really consider the cost benefit of our criminal justice system as well. So let's go ahead and take a deeper look into how these models function and what their specific outcomes are. So the Portuguese model of decriminalization was implemented in 2001. And under this model, the criminal penalties for drug possession are entirely removed. And this is for what is considered personal drug possession, or roughly a 10-day supply of any substance. And it's recategorized as an administrative offense, something similar to a traffic ticket here in the US, and usually accompanied by an order to attend what is called a Dissuasion Commission. And this Dissuasion Commission really lies outside of the criminal justice system. There, people meet with a social worker, a medical professional, and a lawyer generally. The circumstances of their drug use are discussed. The panel tries to make an assessment as to whether a person is experiencing problematic drug use and whether they would benefit from treatment or other services. And based on this assessment, they provide some sort of administrative sanction that might look like a fine, it might look like community service. And again, this commission really plays an important role in determining whether that individual would benefit from referrals to other health and social services. So of course, this might look like treatment or harm reduction services, but it's really quite a wraparound service. And they can also refer them to mental health services, education, employment, and housing. And what I want to emphasize here, and what we discussed last time, is that not only did they decriminalize drug use, and the possession of small amounts of drugs, but there was also this sort of complementary investment into public health and social services in parallel to that legislative change. Now, if we look at the Czech Republic, their history around decriminalization is a bit more complex, but the current model of decriminalization that they have in the Czech Republic was established in 2010. And similarly, it removes criminal penalties for the personal possession of illicit drugs. A threshold is also set at what is estimated to be a 10-day supply of any substance, and you're only given an administrative offense. This usually comes along with a fine, but again, is outside of the criminal justice system. Additionally, people who use drugs have access to harm reduction and support services, which are generally not mandatory or coercive. And I think different in the Czech Republic to Portugal, the Czech Republic already had quite a robust set of harm reduction services available, such as needle and syringe exchange, medicated assisted treatment, low threshold drop-in centers. And so they didn't necessarily scale those up in parallel with decriminalization, because since about the 1980s, those were already quite available. Now, if we want to look at the impact of what both of these decriminalization models had, I think the first thing that we need to look at is how did this affect drug use rates? So I think most people have this assumption that if you decriminalize, then drug use rates are going to immediately go up. But in neither Portugal nor the Czech Republic did that actually happen. And in Portugal, actually, rates of drug use have decreased. And this includes rates of problematic drug use and intravenous drug use. And both countries actually have drug usage rates well below the average within the European Union, which I think is interesting to note. Additionally, and I think really important for this group, is to look at what effect this had on overdose deaths. So in the case of Portugal, overdose deaths went down quite significantly. The Czech Republic, which already had a generally low rate, it remained low. And in both countries, the overdose death rates are well below the European Union average. So again, a really positive outcome for decriminalization. And in addition to that kind of public health concern, we also should look at the impact on HIV, hepatitis C, and tuberculosis, and its prevalence among drug-using populations. So again, one of the main reasons that Portugal decided to decriminalize was in response to a growing HIV epidemic. It was already, HIV prevalence in the Czech Republic was already relatively low because of their robust harm reduction services. In this sense, they're sort of an outlier in the Eastern European region, which generally has very high rates of HIV and punitive approaches to drug policy. But after decriminalizing, HIV rates in Portugal fell dramatically, as well as rates of hepatitis C and tuberculosis. And in the Czech Republic, they were able to maintain that low rate of HIV despite growing rates of HIV in the surrounding countries. And lastly, drug decriminalization in both countries really reduced the burden on the criminal justice system. Not only are numbers of incarceration lower, but it has allowed law enforcement to focus on more serious crimes. So as we kind of reflect on these models and their outcomes, it's clear that there are positive outcomes, not only in terms of health, but also regarding the social well-being and conditions of people who use drugs. And additionally, I just want to emphasize that the reasons both countries decided to shift away from a criminal justice approach to drug use towards a public health response was actually for different reasons. One being kind of this very pragmatic cost-benefit analysis, and the other being the need for a really robust public health response. And if we kind of look at what does that mean for us here in the US, it's clear that our current punitive drug policies have negative impacts on people who use drugs and on society as a whole. Not only are we dealing with an escalating overdose crisis, which is escalating even more within the context of the COVID-19 pandemic, but we're also facing the issue of over-incarceration and racial disparities within the criminal justice system. And we need to establish health and social services for people who use drugs, which are truly accessible, and part of making it accessible means removing criminal penalties. And just to close, I want to note that the success of both of these models is due not only to the legislative change, but also to their successful implementation. We can look at other attempts at decriminalization around the world, like in the Russian Federation, where implementation was done so poorly that it actually caused even more negative impacts. And part of that had to do with the implementation around thresholds. Thresholds were set so low that many people found with extremely small quantities of drugs were actually criminalized for harsher crimes such as trafficking. And at the same time, services were not scaled up. So there's almost a total non-existence of harm reduction services and access to health and social services for people who use drugs. And so the implementation is really a key piece as we think about decriminalization. And for those of us who are, very much in support of this, ready to advocate for this, I think that, let's move forward with legislative reform, but that's really the first step. And the work continues and a new step begins after legislation is passed to really work on successful implementation. We have to ask questions about, are we taking the needs and the realities of people who use drugs when we're crafting these programs and really scaling up services that are accessible and meet their needs. Health and rights should really be at the forefront of decriminalization, and that will ensure that we're working towards similar positive outcomes as we've seen in Portugal and the Czech Republic. So thank you, everyone. I will turn it back over to you, Nancy.
Thank you. That was certainly excellent. And Giovanna has a worldwide experience, so it's such a benefit for all of us to learn from you. The next speaker I have a pleasure of introducing, Tashia, is that correct, from the Drug Policy Alliance. I'm not sure that I can read her entire bio because she has been, she's presented at drug policy reform issues across the country and internationally, including presenting at the Obama White House convening and at the United Nations Commission on Narcotic Drugs. I would imagine her most recent accomplishment is the fact that she is one of the chief architects of the Oregon's Drug Addiction Treatment and Recovery Act of 2020, the first ever drug decriminalization initiative in the United States. She also played a key role in the drafting of Colorado's Amendment 64, which legalized marijuana in 2012, and California's Proposition 47, which is the Safe Neighborhoods and Schools Act of 2014, which reduced numerous felony offenses to misdemeanor. So we're very fortunate to have her with us today, and I will turn it over to you now.
Great. Thank you so much, Nancy. And good afternoon, everyone. It's certainly a pleasure to be presenting on this webinar, and thank you, Lent. I am going to speak about the Oregon model shortly, but initially I'd like to just go through some background information about, let's see, gosh, I am really sorry to say that my slide has frozen. So Giovanna did talk about some of the benefits of decriminalization, but I just wanted to ground my conversation in a broader context. In the United States, drug possession is the single most arrested offense, and the consequences of arrest are very severe, as we all know, in terms of who is arrested and convicted. And has, drug criminalization has led really to an over-policing in communities of color. Both my former panelists talked about the overdose crisis, and as a result of investing heavily in the criminal legal system, we've then, had a diminishing returns and diminishing investment in treatment and a harm reduction infrastructure. And so some of the benefits of decrim are obviously all of the impacts on the criminal legal system, reducing the number of people caught up in the system and serving serving their time, but experiencing lifelong consequences from having a drug conviction on their record. Of course, in terms of investment in resources that are actually cost effective and efficient and actually have a positive benefit on society. The racial disparities is a big component, obviously. And one of the big things, and as borne out in the, in the models that Giovanna just mentioned, is when you remove criminalization, you really remove the stigma, which is a major barrier to access treatment and services. And, the results from Portugal speak for themselves, but, the outcomes are very promising in terms of treatment admission and success in treatment. And then by removing criminalization, you also remove some of those barriers to evidence-based practices. For example, drug checking under our current criminalization regime. Drug checking kits might be prosecuted under drug paraphernalia laws, which are illegal in a lot of states. And so the regime of criminalization really does impact the ability to provide evidence-based or evidence-informed practices. So now I'd like to talk about the Oregon measure 110, which was passed in November a few months ago by a 17-point margin. It's the first time in the United States that there's a major state that has taken a step forward to essentially dismantle the system of criminalization that people in the United States are so used to experiencing. It's a first step to really cracking open the system of punishment. And, in the context of drug policy, we see how the criminalization and the role of policing has really been seen as a solution to any kind of perceived social problem. And now that we have an example in Oregon where drug possession has been decriminalized, it really throws open the system of do we need the heavy hand of the criminal legal system to address any kind of perceived social ill or perceived social problem. Of course, the impact on racial disparities, I'll get into that shortly. The Oregon measure in a nutshell, it did, the decrim component is that it eliminated criminal penalties, created a civil fine for anyone caught possessing personal use amounts of any drug. But the person can avoid a fine if they complete a screening or a health assessment. And once they complete that assessment, there's, if there would be referrals to treatment or other services, but there's no mandate to access any of those services. So it's a fine, but it can be avoided if somebody connects with a screening or an assessment. Similar to the Portugal model, the decriminalization was paired with really an expansion and an investment in the public health and harm reduction infrastructure. The measure identifies a revenue source from existing marijuana tax revenue to be deposited into a treatment fund to expand access to services. And then also the diverted costs from the criminal legal system from arrests and prosecution and convictions. Ultimately, those savings will be invested in this treatment fund to expand the infrastructure of services. I will provide you with a website so you can see more specifically what services are going to be prioritized. But in a nutshell, they're going to be, the funding is going to go to provide immediate triage for folks. So as I mentioned, a fine can be avoided if somebody connects with an assessment. So initially, there's it was called Addiction Recovery Services or Addiction Recovery Centers are going to be created throughout the state. They can be existing organizations, government-based, community-based, or new ones, where it's going to be the initial point of contact, kind of a triage point to connect somebody to services. In addition, so while there's that initial referral line that's going to be set up, there's also going to be a very robust investment to increase community access to care. And that's going to be, treatment, and I have it listed on the PowerPoint, you can read it all, but all of the criteria for the treatment programs that will be funded, peer support and recovery services will be provided under this measure. Housing, which is a huge issue, I imagine, in many jurisdictions. So there's going to be housing support, and then really a rapid expansion of harm reduction interventions as well. I think, as Giovanna mentioned, it was really critical to pair decriminalization with an expansion in services at the same time. And so the Oregon model, if you will, really tried to closely track best practices from abroad. In terms of racial disparities, I did mention, one of the huge benefits of decrim. I wanted to just highlight that, a state government body in Oregon during the campaign did an evaluation about the impact of decriminalization. And the Oregon Criminal Justice Commission essentially found that with decriminalization, it's expected to reduce racial disparities in drug arrests by 95%. It's a pretty staggering figure. In addition, they're not just the, disparities in arrests, but there are disparities in every system, every point in the criminal legal system. From arrest to who gets prosecuted to who gets lengthy sentences, questions around bail and pretrial detention. Those disparities, racial disparities, exist at every level in the system. And this Criminal Justice Commission found that there are going to be likely reductions in those disparities as well. So once again, I want to point to what Giovanna just mentioned in terms of implementation and how critical that is. As challenging as it was to even pass the very first ballot measure in the state, I think the hard work really does begin now, or it began the day after election, because implementation is absolutely critical. And so in that regard, there's the Health Justice Recovery Alliance, that is a newly formed entity that is capitalizing on all of the coalition building that was that happened during the campaign, and essentially working with some of those partners to make sure that implementation is effective. And so February 1st, in just three days away, or 4 days away, if my math's correct, the Decrement provisions will go into effect. And there's this Oversight Council that needs to be in place. So all of these, in terms of who's going to be appointed to that council, that work has been ongoing since the day the Oregon measure passed. And then this telephonic screening and referral line that I mentioned earlier needs to be up and running on February 1st, because that's the way that citations are going to be waived if somebody contacts this telephonic referral line. And so I too want to stress the critical importance of implementation, that we can have any kind of victory, but if it's not implemented correctly, we're going to see backsliding and the system's going to adjust. So it's really important to make sure that the will of the voters and the goals of Decrim are actualized. And so I think I see Nancy, which is my cue, and I'm done. So thank you, Nancy.
Thank you. That was an excellent presentation. We've had other webinars as well that I've been able to sit in on through Giovanna, that shows all the details and how successful Forfeiture was with this, with the Oregon initiative. And I will say to all the people that are attending that part of that Oregon initiative, the success of it went to people in recovery, individuals, and the whole recovery community, which is something that's wonderful to adopt to our state of Maryland. So I thank you for that presentation. The next presentation is from Tony, and Tony Duffin is from Ireland. And I believe I got to meet Tony through Giovanna. And we're fortunate to have him because even with the time difference in Ireland, he's made a significant difference. He's the CEO of the Anna Liffey Drug Project, a position he's had since 2005. He's had a number of senior management roles in the addiction field, including playing a key role in opening up Ireland's first emergency accommodation for young people who inject drugs, and Ireland's first wet residential service for entrenched street drinkers. He played a key role in advocating for the misuse of drugs, which is the Supervised Injection Facility Act of 2017, which was signed into law on the 16th of May, 2017. Tony holds an MS degree in drug and alcohol policy from Trinity College in Dublin and a postgraduate diploma in research and health practice for the University of Bath. So we're very lucky to have him, and I look forward to hearing from him. Thank you, Tony.
Is that better?
Yes.
Okay, apologies everybody. So thank you, sorry, good evening from Dublin. It's dark and it's wet at the moment. I'm going to present to you about, well, advocating to decriminalise people who use drugs in Ireland. And that language is used very, very carefully. We're talking about decriminalising people and not necessarily drugs, and messaging is very important. So it's worth thinking about these things. I'm not necessarily talking just about problematic drug use, because people often think of it as around addiction. We're talking about what Eric really was talking about at the beginning, which was risk. So non-problematic drug use that is problematic, etc. Yes, that it's a health response each time. We're talking about a health response as opposed to a criminal justice response, and we're talking about it being a health response each and every time, because if it's a health response the first time, therefore it must be a health response the 100th time. And these things are very, very important when you're thinking about how to communicate when you're advocating for a change towards decriminalisation. In Ireland, for example, we know that from the Future of Policing report, 80% of interventions are not criminal justice interventions. The police, the Gardaí here work on 80% of their interventions are essentially public health issues as opposed to criminal justice issues. So I just want to give you a quick overview of the current situation in Ireland. So we've been advocating for some time, colleagues in other organisations, so before December 2017, but just to tell you that the government in Ireland established a working group to consider alternative approaches to possession of drugs for personal use in Ireland. Then in April 2019, the working group report was submitted to the Minister for Health and the Minister for Justice at the end of April 2019, along with a minority report of all things from the chairperson, who didn't agree with the findings of the working group and wanted to retain prohibition, essentially. So that was interesting in terms of the dilemma between the working group and its own chairperson. In August 2019, the government announced significant reforms to possession of drugs for personal use, in line with its commitment to pursue public health approach to drug use in Ireland. And essentially, they announced that they would have a health-led response to the possession of drugs. But what would that look like? In Q3 of 2020, a small implementation, monitoring and evaluation group was set up to progress the health divergence approach, with phase implementation expected to begin in Q3. Sorry, in Q3 of 2019, I should say, and in Q3 of 2020, a year later, we were expecting to hear more. But of course, the pandemic had an impact on the situation globally, and Ireland was no different. So things were delayed, and we expect to hear about how the model will exactly be implemented in early March of this year. We're hopeful that that will be the case. We know that there will be initially a referral to health supports on the first instance, and then possibly on the second, and then to court on the third. That's broadly in a nutshell. So from my perspective, I would see that as one opportunity rather than three opportunities. And then just more recently, the possession of cannabis was recently added to the adult caution scheme for the first offence. That was recently added. So we're moving in the right direction, and I think what Tesha was saying about implementation is really important, because it could be set up to fail as well. And obviously, the design, the development of your model is all important. That's why I say if it's a health issue the first time, it's a health issue the 100th time. But I just want to go back at the moment to show you, so just give you some insight into how, as a civil society organisation, we campaigned for the decriminalisation of drugs for personal use, or to decriminalise people who use drugs, indeed. So yes, so the Safer from Harm campaign was a civil society campaign to decriminalise people who use drugs. It influenced policy, agenda, and policy, public opinion, and changed the narrative around people who use drugs. They were at means. and it was a coalition of many civil society organisations, including some private businesses, as well as non-government organisations and civil society organisations. How we did that was we engaged with the public, and we engaged with politicians and such, and we avoided echo chambers. Basically, you can always find people to agree with you, but you really need to go out and engage with people. So we went out and we held town halls. So we went out and had public meetings in cities and towns across Ireland, and we engaged with people, large groups of around 120 to small groups of around, depending on the size of the town, 20 people or so. We did a public attitude survey, provided public attitude research to aid the message development. And we had a website, obviously, a launch, and coalition building and newsletter, enhancing the campaign brand and reach. And we had a social media campaign which was effective, engaging and informative and shareable social media content to build movement. And we had, I'll show you in a moment, but we had people with public personas and famous people, certainly in Ireland at least, who were able to help us get the messaging across. And obviously we had the human stories of people. Sorry?
Really quick, I'm going to have you.
We had the social media campaign, and then we had quite a number of reports there. We did something on the Dublin Drug Policy Summit in 2017, Not Criminals Report in 2018, and then Ireland and the Human Rights of People Who Use Drugs 2019, People Policing the Trust in June 2019, and they're all available on aldp.ie. So I just want to try and give you some sense of some of the social media, but really I'm just going to skim through these. So we had public attitude survey, which gave us improved messaging around. I hope you can see this. Drug use should be dealt with by a health system, etc. We had the Safer from Harm website, which you can visit. We had people like Mango, who was a rapper, on the social media, who helped us get messaging across to one demographic, or a particular demographic. We had the human stories from Rachel. This is Marion Keyes here, who has sold 65 million books, and she joined and novels, and she had took part. We had people like Maureen Penrose, who a mother of a son who has difficulties. Here is Jack Nolan. Jack is a retired assistant commissioner for the Gardaí, the police force, and he was very publicly supporting decriminalization. We had singer Damien Dempsey. So you can see, I'll just sort of give you a sense of the kind of people who helped us to get our messaging across. This is Christy Moore. Christy would be a person who's famous in Ireland for singing, a singer-songwriter, and he was known for his problems with alcohol back years before, but on this occasion he talked about his issues with cocaine for the first time, and helped us to explain the human consequences of drug use and the risk that people take and why we should decriminalise drugs. So there's more about Christy. This is PJ Gallagher. He got involved. That was very, very popular. He's a comedian and an actor and such. So just to give you a sense of some of the people that rode in behind us. So just aware of time, I apologise for the difficulties with the presentation, but just some lessons learned. You need to engage and empower people who support you. You need to try and bring as many people as you can along with you. Some stakeholders did not want to change, and some people had moral objections to the proposed change, and you really need to know when you have to just draw the line, when you can't really convince people to come along with you. So not everyone will agree with you. Know the arguments for and against your proposed change. Language is important. For example, the term decriminalization does confuse people, but since I first did this presentation, I think people are really coming to terms with their understanding of decriminalization as a health-led response to drug use. I just think that all of our work collectively as advocates is really helping people to understand that side of things. And yeah, just in terms of, I mentioned it earlier, do avoid the idea of an echo chamber. In 2021, we'll be monitoring the policy process. The second working group will be announcing how they're going to implement this new policy in Ireland. And then we're going to monitor the impact of COVID-19 as well in terms of drug use in Ireland, in terms of the health ed approach. These things are all intertwined. And then finally, yeah, I just want to say thank you. I apologize for the confusion with the presentation. That hasn't happened before, typical. And just some contact details from you there. So thank you very much. I don't know how much overtime I went, but I'm up and doing that.
Well, I just want to thank you, Tony. I appreciate your time and the fact that you're in another time zone, in another country, and that we certainly can learn from your expertise and the experience you had. Our next speaker, I've had the privilege of knowing for several years, and when he first spoke at one of our Tuerk conferences, I was completely blown away. It's Major Neil Franklin. He's the former executive director of, the Law Enforcement Action Partnership. I just know it as LEAP. He's a 34-year law enforcement veteran of the Maryland State Police Department. Major Franklin was recruited in 2000 by Commissioner of the Baltimore Police Department to reconstruct and command Baltimore's education and training section. During his time on the force, he held the position of commander for the Education and Training Division and the Bureau of Drug and Criminal Enforcement. He also instituted and oversaw the first domestic violence investigative unit for the Maryland State Police. While serving as a narcotics agent with the state police, he was persuaded by then Mayor Kurt Schmoke, who declared that the war on drugs was counterproductive and created excessive violence. This followed by the tragic murder of his close friend, Corporal Ed Totley, while making a drug buy as an undercover agent, cemented his resolve to reform the failed drug war policies. He retired from policing in 2010 to lead LEAP as executive director, and he volunteers on many boards, and we're very fortunate to have him speak with us today. So I'll turn it over to you, Neil.
Thank you, Nancy, and thank you for this great opportunity. I want to say that there have been some really good presentations. All of them have been excellent, and I continue to learn from each and every one of you. So just real quick, Law Enforcement Action Partnership, who are we? So this is a quick statement from our vision statement, a quick phrase from our vision statement. It says the Law Enforcement Action Partnership envisions a world in which criminal justice and drug policies keep our communities safer. Ending the war on drugs and looking beyond the criminal justice system for a range of solutions to address society's ills will better protect human rights, reduce violence and addiction, and build public respect for and trust in law enforcement. We're a collection of, criminal justice professionals from all around the globe working on that issue and more. So let me get right to the point here regarding what I'm going to do regarding the connection, the nexus between decriminalization of people who use drugs and policing, and where we're at with police reform today. Because right now, with this failed war on drugs, when you look at cops, courtrooms, prisons, it costs U.S. taxpayers well over $1.5 trillion today, just over the past few decades. When we talk about where we are now with police reform, some of these names may come into your head: George Floyd, Mr. Blake, Breonna Taylor, Stephen Clark, Botham Jean, John Crawford, Tamir Rice, Sandra Bland, Eric Gardner, in my hometown of Baltimore, Freddie Gray back in 2015. Eric spoke of two ways the government can restrict or revoke your liberty. And I think we all value liberty. There's a third way, that the government can take your liberty permanently, and that's by taking your life. And those names that I just mentioned, that's what happened. You know, decriminalization in relation to police reform, it is a significant police reform measure, but no one's really speaking about it. We hear about abolishing chokeholds. You know, we hear about new policy and laws regarding the use of force by police officers. You know, we hear about reforms such as police officers' Bill of Rights and eliminating it, and qualified immunity, doing away with that. But we're not talking about decriminalization, which could be probably one of the most significant reforms that we can make. Unconstitutional policing. You know, post the death of Freddie Gray in Baltimore, the Department of Justice came into Baltimore and did an in-depth investigation, a deep dive into policing practices in Baltimore City. I believe it was 2005. From 2005, I see the number of arrests that Baltimore police made in 2005. So 600, just a little over 600,000 people was the population in Baltimore in 2005. Yet the Baltimore Police Department had made over 108,000 arrests in that city during that year. And I believe it was the ACLU that sued them. Now, some of these arrests were the same people made over and over again, but imagine at 108,000 arrests in a city of just over 600,000 people. You know, they also concluded that there were thousands of unconstitutional stops that resulted in what we call street corner strip searches. 7 Black men who had been stopped and searched more than 30 times, and some of them with absolutely no arrests ever made. And we know what that's about. It's about the police looking for people possessing drugs. So we're at a moment where some police reforms, some of those that I had mentioned, they will happen. We see the legislation being proposed at various state levels. We're seeing legislation being proposed on Capitol Hill, and some of it's going to happen. The question is, which ones, and will they be effective? So it's time to divest our police from addressing conditions that are not and should not be in their wheelhouse. And I strongly believe that this is one of them, what we're talking about here today. And there are many. So let me just say this. In doing so, there are some other added benefits, many, many benefits. And I think one of them is the actual shifting of resources from policing, from corrections to those very valuable, very much needed neighborhood and community-based resources, services that we need. So think of housing, think of our large population of people all across this country who are houseless. Think of education and how we're failing in education in many of our communities. Think of nutrition, think of environmental health services, think of mental health services, think of treatment services, and on and on and on. And it seems like at every turn, we just don't have the financial resources and other resources to provide those needed services. Decriminalizing drug users, I believe, and we at LEAP believe, is the first step. It's time for police to stop using finite resources and arresting people who use drugs when resources are needed for those other things that I mentioned in our neighborhoods and communities. We have programs like Law Enforcement Assisted Diversion, LEAD, but with programs like LEAD, the police and sometimes our courts are still involved in using these vital resources. Not only are these, resources monetized, but, in our courts, where we are also dealing with people who are committing violent crimes, you know, where those cases need the attention by our prosecutors and assistant prosecutors and so on, so that they can be properly adjudicated. And I won't get into the details of that, but, you know, again, we continue to waste court resources on, you know, people possessing drugs. So those programs that I mentioned are somewhat effective for now, but as we move forward in time, how do we move farther away from police involvement, from our courts being involved? And again, moving in this direction of decriminalizing people who use drugs, I believe is quite significant. We're also at a point where we're talking about safer drug consumption facilities, right? Oh, and some people refer to them as overdose prevention sites, which is a really good term because we've had not one single overdose death at any of these facilities around the globe. I just last week concluded some testimony here in the state of Maryland where we continue to try to move that forward here in opening up such facilities as Insight in Vancouver. You heard Giovanna talk about Portugal, the Portugal model, where they've moved drug use out of their justice system, you know, and are addressing it with health solutions, public health solutions. You know, this is divestment. This is a form of divesting from, you know, the police and criminal justice and placing those needed funds into a place of health, which long-term is going to do a proper and much better job in also in reducing violence and improving public safety and improving public health. I've had the opportunity to speak with many police chiefs and sheriffs across the country, and they are more than willing to stop jailing drug users, but they know that currently the necessary treatment and holistic services that are needed are scarce, if available at all in some of their jurisdictions. So they're quite reluctant at this point to advocate for decriminalizing drug users. But we're seeing, you know, forward movement in Canada. Many of our police chiefs and sheriffs are going there. They're learning from what's happening in Canada, but we still have to establish and beef up these much needed resources, again, by shifting funds into the public health arena, shifting those funds from policing and corrections in our courts. So it looks like we have a dilemma, you know, what to do first. Do we start shifting the funds? You know, how do we start establishing these needed services if we're going to, you know, decriminalize it? There's so many things. And my point is, let's begin with taking funding from the many unfilled police positions, the many unfilled corrections positions that we have within our cities and states and towns and counties across the country. Many of these positions have been unfunded for a very long time, and the money is there. You begin there, shifting those resources, establishing the needed services that we need within our communities that I've mentioned and more. And, you know, at the same time, we're going to, you know, be shrinking the need for, or should I say, shrinking that policing footprint within our neighborhoods and communities. So we will divest to invest in those things that are going to make a long-term, meaningful difference in public health and public safety within our communities. And so, you know, we must get this train out of the station, and I think now's the time. So again, as we are involved in these conversations about police reform and all the many things that we continue to hear, pieces of legislation being proposed, some of which I mentioned, you know, we've got to start talking about decriminalization. So if you look at history, this moment of police reform focus will not last long. If you think about the 1960s, during the civil rights movement, this big groundswell of focus on reforming police was, involved in that as well. We had the 1990s, which was resulted from the Rodney King beating in California. We had a moment then that we were out there trying to reform policing in this country. As recent as Mike Brown and Freddie Gray, we had it. And here we are again. And now we have an administration that just took the helm in the White House and in DC. And so we had this very special and unique opportunity that we can't squander and that we must act upon. So by moving forward with decriminalization, as in the Northwest and Oregon, we can begin this process and hopefully not waste another opportunity. So I'll end with this for future thought. If we believe that people who use drugs should not be arrested or jailed, then we have to create an avenue of safe and legal access, a safe supply and legal access to drugs. That's as we move beyond decriminalization. So we should always be thinking the next step and the next step down the road. And I'll actually end with this. And if we believe in liberty, then we must end drug prohibition altogether. And that's even further down the road, beginning with decriminalizing people who use drugs. We must not prohibit consensual adult behavior. And that can go into other areas. So I'll leave it at that. Think about how we have prohibited and continue to prohibit consensual adult behavior. I call that morality policing, and that's not a place for us to be. So thank you, everyone.
Thank you, Neil. That was certainly excellent. And I've had the good fortune of hearing Neil and talk about policing from a public health lens. And that's where we want to get to for all our individuals. Don't forget to put your questions and answers in the Q&A. And I'm actually going to start with a question for Giovanna, which is, what year is the overdose data from Portugal, the one you're discussing?
Yeah, thank you, Nancy. So most of the data that I'm looking at is coming from the European Monitoring Center for Drugs and Drug Addiction. And their most recent sort of official report is from 2017. And it shows sort of the last 10 years of overdose rates. And I think when we're talking about those numbers, it's important to think about what numbers they were experiencing in the 1990s before they decided to actually implement decriminalization. So in the 90s, they're looking at overdose death rates in the hundreds, looking at 300-400 people dying a year. And if we look at the recent years in Portugal, of course, not the most recent because this report is from 2017, but the most recent data we have, you're looking at overdose deaths from 25, 30, I think highest is around 50 people per year. So quite low rates. And I kind of peeked at the second question as to how the overdose rates in the EU compared to the US. And, overdose rates in the European Union are extremely low compared to the United States. And I think it's important to note that, if we look at the total EU population, of course, that's higher than the population of the United States. So I think from a similar report from the European Monitoring Center for Drugs and Drug Addiction, in 2017, there was, I think, roughly 8,200 overdose deaths. So still too many, but much, much lower than the overdose death rate that we had in the United States in 2017. And I think there's a number of factors into why that death rate is so much lower. Of course, I think fentanyl has not as widely contaminated the drug supply within the European Union. But additionally, even for countries that haven't yet decriminalized in Europe, there are still, in many of those countries, a really robust harm reduction system. So, you know, services are quite available, and those include not only, you know, medication-assisted treatment, needle and syringe programs, and just generally accessible health and social services, but also safe consumption sites, overdose prevention sites as well. And I think that that also plays a factor into why the general rate within the EU is so low. But of course, we can note that the Czech Republic and Portugal are low even for the kind of European average. So generally low rates to start with, but even lower in those countries which have decriminalized.
Okay, thank you. Our next question or comment is for the entire panel. Whoever would like to answer. It's from Dr. Joe Adams. The main argument of opponents of these laws, police and prosecutor organization, is that arrests are needed to help coerce people into treatment. I'm not sure how best to summarize the evidence in a convincing way. So I'll open that up to any of the panelists.
I know you mentioned policing, but I've heard Eric speak about this before. Eric, regarding, and I guess it's sort of kind of tied to liberty. But there's, you know, really no, to my knowledge, no empirical evidence that coercion works, and we actually, you know how problematic it is. I always, when I have conversations with these police chiefs and these sheriffs and others in law enforcement, I always tell them, I said, well, you know, we've, you know, in our lifetimes, we've never really had the opportunity to really offer people meaningful treatment without coercion, if that's in fact what they want. And, you know, ultimately, I think we need to get to a place where we have to realize that people have the desire, and they have they have the right to use drugs. And I think we as a society have a duty to ensure that they have access to the safest possible drugs that they can use, and create, and Eric, you've always spoken about creating safe environments for people to use and experiment. I guess what I'm saying is, I try to go further in educating those who wear the uniform like I used to wear, that we have to get to a place, and I mentioned it earlier, away from morality policing, away from laws that are dictating to adults what they can use, what they can ingest, what they can eat, what they can drink. And I think when you do it right and head down that road, especially with folks who are conservative, and you start talking about rights, you know, the rights of people in this country, and Eric, again, liberty, you know, then they begin to get it. But it's not a conversation that you can have, you know, in a few minutes. It's just, and I mean, I was once there. I made the turn. I was very conservative when it came to that. And I know many others as well. And I think that's the direction we have to head in, because it's a never ending conversation that I've found leads virtually nowhere when you get into this place of, well, coercion, well, they need the threat of jail time, they need the threat of arrest, but, you know, the damage that does to someone with that record, even of an arrest, you know, and I've been able to lay that out to them by using databases where you can run someone's name and find every time they've been arrested, whether they've been convicted or not, you know, and when you show them that and then relate that to them not being able to get employment, how it affects their education, access to critical government services and so on, then they start to get it, but it takes a really long and sometimes repetitive conversation.
If I may, just on the idea that coercing people through the criminal justice system is working, certainly drug courts don't have great outcomes. And in terms of the motivation of people to change, you know, encouraging people through offering them help rather than telling them or sending them off the treatment works much better than you know, the encouragement. I've seen the Portuguese model in action. I've been in the Dissuasion Committee meeting. I've spoken to people afterwards, and there's enough inconvenience being sent to the Dissuasion Committee in that process, not shame, but inconvenience, and of the person, and then being spoken to by a health individual worker and offered when treatment is deemed to be appropriate, offered the opportunity rather than forced to take it or coerced to take it. And then the person comes back. If the person comes to the attention of the authorities again, they get offered again. Nobody is made to do anything. So I just think that's interesting.
Yeah. Our next question is, how is the...
Can I just add something? I'm sorry.
Excuse me, go ahead.
Okay, thank you. I was just going to say, you know, the evidence from drug courts show that, which is the coerced treatment model, shows that they're not more effective than voluntary community-based access to treatment in terms of various indicators, from treatment engagement, retention, completion, or even reductions in drug use. And if anything, you know, coerced treatment is just so, even if they're equal and they have equal outcomes, it's far more destructive to an individual to go through this punitive criminal justice system, which, you know, saddles them with lifelong consequences. And so even if the results are the same, it's far more effective to go through the voluntary treatment route and avoid the harms of criminalization. But sorry for the interruption there, Nancy.
No, I appreciate it. Thank you. Our next question, let me see, is how is the decriminalization movement in Maryland marrying to the overall healthcare discussion? As in, how are we pushing towards more access to treatment and holistic social support? Like Giovanna spoke about this, none of this works unless we have better access to social services and public health infrastructure. Anybody like to comment on that?
There is actually one of our, who used to actually be the chief of staff for Eric, Amos Irwin, who is now one of our programs director for LEAP. He and another person just put together did a report and a study on community responders. And a big part of this report, which I can put a link in the chat, deals with mental health. It deals with analyzing 911 calls for service. Mental health calls are a big part of that, and having the appropriate service available 24/7 to respond, train people. Sometimes they may respond with law enforcement, sometimes not, depending upon the call itself and how the call is analyzed, what the actual situation is. And it goes beyond that to other calls for service as well. And of course, drug use is one of those as well. So that we, you know, again, slowly remove the police from responding to certain calls dealing with mental health or drug use, overdose calls, and so on. But I'll go ahead and dig that out and put that in the chat.
The next comment for the team or the panel is that it's being said that the unfortunate truth is that for most people without resources, they can only access treatment through the criminal justice system. Anybody, Neil or Eric, would you like to comment on that?
Yes, go ahead, Eric.
I I was simply going to say that it depends on the jurisdiction. It depends on the state. It is, it's one of the rationales that the prohibition establishment uses for the status quo, that the justice system is an effective and efficient way to get people into treatment. And yeah, I think there are many anecdotes, you know, that are verifiable of many people who've benefited from their criminal justice-based treatment. But it's expensive and it's costly. I'll stop.
Yeah, and that's part of this whole community responder model that I just put the link in the chat. Again, this is about the divesting in public safety. When I say public safety, I'm really talking about police services and corrections, divesting in those things that aren't producing a positive result for our neighborhoods and communities, and reinvesting that money into better, robust 24/7 programs and services, so that people, when they need them, whether we're dealing with addiction, whether we're dealing with mental health issues, they can go and get good quality services that are needed. Go ahead, Eric.
I just wanted to say how much I thought what Giovanna contributed in talking about the experiences in Portugal and the Czech Republic were so valuable, and any links that you can provide for English language analyses, Giovanna, would be very, very welcome. Just an enormous contribution to our whole discussion today. Thank you.
I have one more question. This is to Neil Franklin. To what degree does law enforcement funding depend on ongoing criminalization of drug use? Do they oppose decrim because they'll lose funding?
So this is huge in many ways. In addition to government funding, burn grants and so on, which are literally millions of dollars every year going to different law enforcement agencies to, again, fight the trafficking in drugs and drugs in general. We have funding that's out there supporting drug task forces. And I mean, the list is very, very long. But we also got to take a very good look at a couple of things. Number one is civil forfeiture, right? So they've already noticed that moving in this area of just marijuana decriminalization that we're starting to see in most of our states across the country, that the courts are starting to restrict law enforcement from searching people and cars. So they see that now, once they are no longer able to do strip searches of people to stop you and say, I smell marijuana, I'm going to search your car, I'm going to seize your cash, I'm going to seize certain property, that's a huge loss, I think, in a good way for law enforcement. But they don't want to see that happen. And they've actually testified to this. Law enforcement folks have actually testified at hearings I know in Maryland legislature hearings, that if they lose this, then they won't be able to find guns. They won't be able to find the bad people and so on. So they don't want to see it happen with marijuana. And we know they don't want to see it happen with other drugs.
Well, I want to thank everyone, our panelists, and I do want to recommend all of the emails of the individuals, the panelists, is in the chat rooms. So you can reach out. And I also would like to suggest for all the 300 people that joined, or over 300, that if you have suggestions or questions for NCADD Maryland, because this is the first webinar in a series of webinars on decriminalization, we would really appreciate that, because we're going to be moving forward throughout the entire year with different panelists and decrim, and maybe we'll get lucky and bring these panelists back if they agree to do that. So let's hope with our Maryland legislature that we can move ahead in some of these issues. And once again, I thank all of you for your time, and for our expert panelists, I thank you again. Thank you so much.
Thank you, Nancy. Thanks, everyone.
Thank you.
Bye.
Bye.
Thank
Thank you,
you.
everyone.
Bye-bye.
I appreciate it and look forward to seeing you
Seeing you
again
all.
soon. Thank you.